Alright, so I'm just kind of going to be talking through some things. I wouldn't usually say everything that I'm looking for during this, but for the sake of this video, I will be saying what I'm looking for or what I'm seeing. So first I want you to kind of just look straight at me, and I'm looking at the symmetry of your face here, making sure that everything's kind of the same size, same shape, and is at the same level. I'm looking at how far apart your eyes are set, the alignment of your ears, alignment of your forehead, and kind of the shape and bridge of your nose. But everything looks good there. So everything is good with facial symmetry. And then, so now I'm just going to touch your face in a few different places, and I want you to tell me if it feels the same in each place, okay?
Okay. Yes.
Okay.
Yes.
All right, perfect. So now I'm going to test your jaw and kind of the range of motion and strength of that. So first I want you to stick your lips out like this. Perfect. And then I want you to smile like you're saying E.
E.
Awesome. And then puff out your cheeks like this. Awesome. All right, so now I want you to alternate between those O and E's. So O, E, O, E.
O, E, O, E, O, E.
Perfect. Okay, so now I'm going to push against you, so I want you to try to resist the way that I'm pushing. So I want you to first do your smile again.
E.
Yep, okay, awesome. And then you can do the O shape again. Alright, perfect. And then puff your cheeks up again, and I'll push against you, try to resist. Awesome. Okay, so now I want you to open your mouth really wide, and then shut it tight. Perfect, and then open and close. Okay, and then move your jaw side to side like this. Awesome. Okay, so now what I'm gonna have you do is I'm gonna have you open your eyes really, oh actually, sorry. Can I have you open your mouth again, and I'm gonna try to close it, so don't let me close it. Okay, and then close it tight, and I'm gonna try to open it. Perfect, okay. So now I want you to open your eyes really wide and shut them really tight. Okay, and then can I have you put your glasses, you can, okay, perfect. So I'm going to have you close your eyes again, and I'll try to open them, but resist it. Okay, perfect. Sounds good. So now I'm going to have you, yep, you can put your glasses back on. So I'm going to have you stick your tongue out, and then you can move it to the right side, to the left, and then back and forth. Perfect. Okay, so now what I want you to do is I want you to lick your lips. And go the other way. Perfect. Okay, so now I want you to kind of lick the roof of your mouth, going from front to back, kind of like you're trying to get peanut butter that's stuck off the top. And then kind of open, yep. Okay, awesome, thank you. So now what you're gonna do is I'm going to have this toothbrush here, and I would typically use a tongue depressor or a mirror, but I don't have that, so I'm just gonna improvise here. So I want you to push forward against the toothbrush with your tongue. Awesome, and then I'm gonna have you push to the side. Awesome, and then the other side. All right, thank you. So now I want you to open your mouth and just stick out your tongue, and I'm just going to be looking at it for a few seconds here, so just sticking it out normally. And I'm looking for any deviations or anything like that. Everything looks good there, so you can put your tongue back in. Awesome, so now I'm gonna get a flashlight out here. So I'm just going to look in your mouth, so I want you to open your mouth wide, and I'm gonna be looking at the shape and palette of your palate, and then also looking at the alignment of your teeth. So that looks good there. So I'm gonna have you just stick out your tongue. All right, and can you say ah for me? All right, and now you can say ah, 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 ah.
Ah, 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 ah.
Okay, awesome, and I saw that rise back there, so that is perfect. Okay, so now, and I typically would here do a gag reflex, but for the sake of the patient, I will not be doing a gag reflex today. So now I'm going to do some speech testing. So I'm going to have you say some different sounds for me, okay?
Okay.
All right, so first just say ah.
Ah.
All right, can you hold it out a little bit? Ah.
Ah.
Nice. And then E.
E.
Okay, awesome. Thank you. And then I was just listening for quality and nasality there, and the difference between those two sounds. And now I want you to say ah again, and I'm going to be pinching your nose during it. Alright, so I didn't hear any shift in resonance in there, so that's awesome. No hypernasality there, so I want you to say E, and I'm going to pinch your nose again, just like that.
E.
Alright, so really no shift in resonance there again. So next the sound is going to be Okay, and now I'm going to pinch your nose again while you say Alright, so there was a change in resonance there, but that would be normal during that, so that would indicate normal functioning. And now I want you to say S.
S.
Okay, now I'm going to pinch your nose while you say S.
S.
Okay, and now Sh. Okay, and I'm not hearing any nasal air emissions on those sounds, so that would be indicate adequate velopharyngeal functioning. So now I want you to do the Sh, and I'm going to pinch your nose again. Okay, perfect. So now I am going to have you repeat some sounds after me. So there's kind of more of these, but we'll just get through them. So pa 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 pa.
Pa 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 pa.
P p p p p.
P p p p p.
Ba 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 ba.
Ba 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 ba.
B b b b b.
B b b b b.
Ta 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 ta.
Ta 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 ta.
T t t t t.
T t t t t.
Da 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 da.
Da 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 da.
D d d d d.
D d d d d.
Ka 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 ka.
Ka 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 ka.
Ki 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 ki.
Ki 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 ki.
Ga 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 ga.
Ga 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 ga.
Gi 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 gi.
Gi 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 gi.
And I didn't hear any nasal air emissions on those voiceless portions or any hypernasality on the voiced portions. So that would be normal for a normal functioning person. So I'm going to keep going with those. So fa 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 fa.
Fa 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 fa.
Fi 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 fi.
Fi 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 fi.
Va 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 va.
Va 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 va.
Vi 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 vi.
Vi 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 vi.
Fa 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 fa.
Fa 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 fa.
Fi 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 fi.
Ti 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 ti.
Sa 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 sa.
Sa 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 sa.
Si 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 si.
Si 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 si.
Za 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 za.
Za 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 za.
Z z z z z.
Z z z z z.
Sha 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 sha.
Sha 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 sha.
She 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 she.
She 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 she.
All right, and so if I did hear any nasal air emissions on those sounds like sh or s, I would use a piece of paper to kind of check and verify that I did hear that. So I'm gonna have you say sha 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 again.
Sha 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 sha.
All right, and I'm gonna put this piece of paper underneath your nose while you do it.
Sha 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 sha.
And she 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 she.
She 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 she.
Okay, so because the paper did not move, that means that he doesn't have nasal air emissions. So that would be adequate velopharyngeal functioning. But if he did have nasal air emissions on that, then that paper would flutter a little bit. So that's how you would verify that. And then, so we're gonna keep going with all of those sounds. So ha 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 ha.
Ha 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 ha.
He 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 he.
He 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 he.
And then cha 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 cha.
Cha 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 cha.
Chi 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 chi.
Chi 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 chi.
Okay, so if I did think that I heard nasal air emissions on the ch sound, then I would use the mirror check test to verify that I did hear that. So I only have a bigger mirror, so I'm just going to use that, but I would typically use a smaller one if I did have that available. So I'm just going to have you say the cha 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 and chi 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 again, and I'm going to put this underneath of your nose.
Cha 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 cha. Chi 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 chi.
Okay, so if he did have nasal air emissions, I would see the mirror fogging up a little bit there, but because he does have adequate velopharyngeal functioning, I did not see that at all, but that would indicate that. So we're almost done here. So just a few more sounds and then some sentences. Ma 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 ma.
Ma 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 ma.
Me 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 me.
Me 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 me.
Na 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 na.
Na 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 na.
Ni 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 ni.
Ni 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 ni.
La 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 la.
La 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 la.
Lee 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 lee.
Lee 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 lee.
Ra 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 ra.
Ra 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 ra.
Re 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 re.
Re 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 re.
Wah 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 wah.
Wah 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 wah.
Wee 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 wee.
Wee 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 wee.
Ya 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 ya.
Ya 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 ya.
Yee 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 yee.
Yee 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 yee.
Nice. Okay, so I know there's a lot of those. So the last thing that we're gonna do is I'm just going to repeat some I want you to repeat some sentences for me. Okay.
Okay.
Popeye plays baseball.
Popeye plays baseball.
Fred has 5 fish.
Fred has 5 fish.
Take Teddy to town.
Take Teddy to town.
Sissy sees the sun in the sky.
Ceci sees the sun in the sky.
The ship goes in shallow waters.
The ship goes in shallow waters.
John told a joke to Jim.
John told a joke to Jim.
Give Kate the cake.
Give Kate the cake.
Buy Bobby a puppy.
Buy Bobby a puppy.
Mama made lemon jam.
Mama made lemon jam.
We were away all year.
We were away all year.
The young chicks are yellow.
The young chicks are yellow.
Nice. Okay, so that's all I have for you today. Thank you.
Thank